Well, it has been weeks since both the approval and rollout of 2 COVID-19 vaccines began.
And while medical professionals say the vaccine is safe for everyone, many Black Americans find it hard to trust that science. 13 News reporter Lauren Baker is digging deeper tonight into the historical context of this dilemma and find out what's being done to gain trust back in the Black community.
It's a glimmer of hope many have been waiting for, the approval of a COVID-19 vaccine. The first American to receive it, a Black New York intensive care nurse named Sandra Lindsay.
She's leading by example. The way she's leading, she's giving us an example of how this will work out in the future.
From the outside looking in, the moment looks like any other moment of someone receiving a vaccine. But for many Black Americans, that moment represents so much more.
I was excited to see it because it was a Black woman. I was excited to see that. But I wasn't excited to see it because I feel like, are we being experimented on first?
The tug and pull between the excitement and the fear some Black Americans feel started way before the COVID-19 pandemic. In fact, it started way before many Black Americans were even born.
Fear that we have is not new. It's a historical, it's over 400 years old.
Since the time of slavery, Black people have been subjected to medically unethical practices and treatments. One of the most famous was the Tuskegee experiment.
If we look at the history of this country and the history of its relationship with people of color have always been used for experiments without any explanation.
From the 1930s to the 1970s, 600 Black men in Macon County, Alabama, enrolled in this experiment. It was run by the U.S. Public Health Service in an effort to research the effects of syphilis. What made the experiment so unethical is that when a treatment drug was approved for syphilis in 1947, none of the men involved were given the drug, resulting in horrible side effects and even death.
And so when you have that in mind, then no, you don't want to be part of the sample. You don't want them to do anything to you.
So fast forward to the present. The world is in a global pandemic, and a new vaccine arrives to protect people from a virus that has already disproportionately affected communities of color, especially the Black community. Even with all this on the table, are Black people still afraid of taking the COVID-19 vaccine?
Yes. Yes, I am.
What are your concerns and where do they stem from?
We are reluctant because we know the history. I was a child and a teenager during the Jim Crow, and I know the things they did to us unwittingly.
Why are you a little skeptical about the vaccine?
You know, it's like every time we become the group, the sacrifice, it gives us reason to pause when something such as a vaccine is created and African Americans are the ones who are more susceptible to the virus.
But they aren't alone. The Kaiser Family Foundation, a nonprofit that focuses on national health issues, says only 17% of Black adults would definitely get the vaccine, a 20% difference between both Hispanic and white adults.
Talking about our lives, you know, and we take it for granted, and a system that at one time and continue to this day does not even see us as fully human.
So what can be done to help Black Americans either consider taking the vaccine or be more open to it? Dr. Arthur Rohn from Mercy Health says it starts with conversations like this one.
I spend a lot of time educating patients about what's going on, trying to give them as much information as I have in terms that they understand. But it still needs to be an individual choice.
While sharing more information about the virus and the vaccine won't fix the trauma from the past, what it can do is help people feel more comfortable so that one day they may be willing to take it. For your 13 Weather Authority, Lauren Baker, 13 News.
And as of today, the CDC says more than 10 million Americans have received their first dose of either the Moderna or the Pfizer vaccine. Something interesting to note, Kristen, that doctor we heard from at the end, he was hesitant about taking the vaccine himself because he considers himself conservative to new medicines and vaccines. But after he did his own research, especially as a doctor, he decided to take it. He's already gotten both of them.
Right. I was speaking with Lauren about this earlier today, and she said that this is a historical problem among Black Americans, and the vaccine has made people very wary about this. But the doctor now hopes with him being more willing to take this, it will encourage others, the minorities in the community, to do the same. We hope so as well.
Interesting to hear that story, all from Lauren Baker.